Hello, welcome back. My name is Daniel McCormick. I'm your host today, and I have with me today again joining us is Jason McCormick. We want to do these talks. We've been trying to put together something to help the average person understand healthcare. And our last set of videos was why is healthcare so expensive? Now we want to talk about uh, what can the individual do to help meet that cost now, or mitigate it, or how do they navigate this complicated system? With me today is Jason McCormick, my father. Would you like to introduce yourself, give us a little bit of your background and your expertise in this field? I've obviously, being your son, I've heard about this stuff my entire growing up, and it's fascinating to me, but our audience members don't know so much.
Well, thank you. Thank you for hosting us once again in a series of episodes to talk about the rising cost of healthcare and other subjects that impact businesses and individuals in our changing economy. So, um, how do I know a lot about this? Well, I've been an executive in healthcare administration, working with a variety of hospitals throughout the Western United States for the last 26 years. Um, I've been in healthcare administration, working in the hospitals. I've worked with different providers, certainly, in that capacity as a large employer in a community. We deal with how do we pay for healthcare ourselves, and even as an individual, as a father of a family, how do I pay for and purchase health insurance for me and my family? And now that I'm a private business owner in a consulting capacity, how do I purchase healthcare for my family and for my employees that are part of that company? So, quite a bit of experience to be able to discuss this topic and to give people ideas, educate them, and then give them ideas on how they can manage these important subjects in a better way.
Awesome, awesome. So you've been working in the healthcare industry for a very long time. Um, as you have continued to work through it, you've obviously got the inside expertise of what does a hospital look like from the financial perspective, from the fiscal perspective, um, rather than from a healthcare services perspective, which I think is a lot of where we as regular people, as regular consumers, get our experience. Right, we go in, we get seen by a doctor and a nurse, and then we're done with that. We go back home and we get this massive bill. We talked about why that is a little bit in our last episode. Um, Part of that, just to kind of summarize, was we have an issue with the availability of healthcare professionals. There is a incredibly high demand for healthcare professionals, but we do not supply enough um, people to be trained in this profession.
Mhm.
So, getting past that, what do we do as healthcare consumers to sort of navigate the system? Where would you start? If someone wants to go in, they need to be seen by a doctor. Where do they start to try and save money, to try and help themselves navigate this in a better way?
A very good question, and thank you for that recap there. In our healthcare system, there's the patient, and then there's a provider, and we're really not trusted to do too much ourselves in with regards to healthcare. As we referenced in previous episodes, go to any grocery store, some kind of a pharmacy, and look at the medications aisle, and you won't see much there that you can purchase on your own. Some cold medicine, sunburn cream, maybe some athlete's foot cream, some things of that nature, pain relievers. Not too much, and so everything we do requires us to go to a healthcare provider, and then from there, that provider will order tests. We'll get a bill from not only the provider, we may get bills from the radiologists, from a lab or pathologist, something of that nature from the hospital that perform those tests. And then we come back to the provider, and then we are sets us up with some kind of a treatment plan. It might be medications, physical therapy, might be a referral to a specialist, eventually surgery. variety of things that can be done. But in the center of all this is a physician. And that gives rise to the need for insurance. Healthcare is because we turn it over to a very expensive process. It's out of our control, and it's kind of like going to the movie theater. Once you walk in the door, you know that the cost of popcorn and the cost of soda is going to be 4 times what you could buy it in any other place, because you're in a captive market at that point. And so sometimes we get bills from a variety of places, and we have no idea whether they participate with our insurance. There's certainly a lot of concern out there. There's a lot of legislation that's being passed with regards to no surprise billing and trying to get providers, force providers to be in network and to accept the rates that are being controlled by the federal government with regards to healthcare reimbursements. But you can kind of see this environment, and it becomes very frustrating as a patient and as a payer of the services. How do we deal with that? Mm-hmm. So that creates this environment that's difficult and not easy to change. We've been dealing with it for many, many years. And originally we had insurance where we would go to a company and we'd say, I'd like to purchase a policy, or maybe our employers, went on our behalf and purchased a policy, and that company would underwrite the cost of that health care, and then they would work with the provider to set up reimbursement rates and negotiate that on our behalf. And that worked for many years, but Obamacare came out, and it kind of did away with traditional health insurance. It taxed health insurance companies. It set limits on the profitability that they could make, and so most health insurance companies have gotten out of that business, and they moved into something else. So if you'll indulge me for a minute, let me talk a little bit about how the industry or our country is set up to pay for healthcare. That'll give us some insights. So if you're over age 65, or if you're disabled, you've worked for an employer or something of that nature, became permanently disabled, you can become a member or a beneficiary of the Medicare program, in which the Medicare Trust Fund will pay for your costs. You have some deductibles, some co-pays. There's a Part A program that pays for inpatient care. There's a Part B that pays for professional services, outpatient care. Mm-hmm. Part D that pays for drug benefits. But the federal government kind of legislates what these benefits are, and they, to a large extent, legislate what is reimbursed. Most individuals who have Medicare will actually go out and get a secondary insurance that'll pay for the co-pays and the deductibles, things of that nature, to help cover the full cost of that. Reasonably affordable. You do have to pay a premium to Medicare for the Part B, but the Part A, you become entitled to if you've worked 10 years of your life, paid Medicare taxes for that. So that's a program that's based upon the fact that you've worked. It's not based upon your income, whether you're rich or poor. It's based upon how many years you've worked. It's an entitlement program.
Yeah.
And we will eventually all get there to being on the Medicare program. Prior to that, if you are a working age individual and you work for a company that can still afford to provide healthcare insurance, your employer may have what is called a partially self-funded health insurance plan. Mm-hmm. And so they will work with a company such as Blue Cross Blue Shield, Aetna, Cigna, some other company. They'll process the claims, but they're not really insuring them. The employer agrees to pay the majority of those costs directly. They just get the benefit of the contracts with the payers from that what used to be an insurance company. There will be a third party, it's called a reinsurance company, that if your claims are over $100,000 for any one individual in a year, they'll cover those, but seldom does that happen, or if total claims get beyond a certain amount. So
yeah.
That's kind of, that's a decreasing trend for companies to be providing that, because the premiums, the total premium between what the employee pays and what the employer pays, could be $2,500, $3,500 a month. The employee doesn't see it. They might be charged $100, $200, $300 a month to employ themselves. But used to be that some of these employers, they provided the insurance. There wasn't a lot of cost sharing with the employee, and you could usually, if you had a family, you could insure your option, your spouse, or your children. But those options are going away quickly and have been on the decline. Another advent has been the change in deductibles. Did you have a question?
Well, just a quick recap on why is that? Why are employers providing less for that? I think we touched on it a little bit, but if you could just recap that a little bit.
Yeah, so when I got started in the industry, I was working for a hospital, and we sold a health insurance plan to large employers in the community, individuals, and we were selling health insurance at that time. This is 1996, 97, selling it for $300. And that included maternity coverage, things of that nature. It wasn't too expensive. $25 copay, $500 deductible. And, most employers were insuring spouses and children. Not a big deal. Wasn't too expensive. But since that time, now premiums have grown tenfold. So they're $3,000 instead of $300. And employers just don't have the resources. The economy in the United States and competitiveness internationally has made it such that providing healthcare is extremely expensive, and it's out of control. From one year to the next, if you get into a program where you've committed to provide health insurance benefits for your employees, and then the premiums go up the next year, you're kind of struggling. And so, over the years, these employer groups have tried to switch to, different strategies to change that. They've gone to high deductibles. That's been an advent in the last decade, and said, well, you could choose this alternative insurance. We've got two insurance policies to choose from, and one's a regular plan and one's a high deductible plan, and we'll give you an HSA account, health savings account. We'll put some money in there, and then if you need to get health care, then you can use the money in that health savings account to pay for that high deductible. And along the way, the premium is going to be $50, $100 less per month. And so a lot of people switched over to it. It didn't really decrease all that much, the premium for the organization. It just shifted costs to the beneficiary. So we call it first dollar. Who has to pay for the first dollar of the care? And when you say that, the average cost per person in a community in the United States runs about $8,000. Take all the healthcare costs in the community, divided by how many people in the community there are, it comes up around $8,500. And so these deductibles are set to be somewhere between $5,000 and $10,000. So even though it's
annual,
it's an annual cost, the $8,500. And so when you add up all those costs and you say, okay, the beneficiary is going to pay for the first $5,000 or $10,000, well, that really takes out a big chunk of what the employer, the reinsurance agent, the insurance company has to pay for. So they like it. They really like that because it's made them more profitable. But it's actually detrimental to the individual, because now we're in a situation where people say, well, I got this high deductible. This is huge, and I've used up the money in my health savings account, or I don't want to use it because I'm saving it up for my retirement or something like that. So they delay getting care, and that's never good.
Yeah.
Most serious issues, most healthcare conditions for which we need to go to a professional to care for, don't always go away on their own. They need some assistance, and they get worse over time. And so we find that the lowest cost of healthcare is as soon as you begin to experience a situation, healthcare condition, is to go and be seen by a provider. Get in as quickly as possible. Don't wait, say, oh, I'm okay, it'll get better. And then 9 o'clock at night, all of a sudden it's really bad because you're tired, it's late, things always get worse at night. And then you're running to the emergency room versus having tried to go to an urgent care during the day, or tried to get into your doctor's office during the day, something of that nature. So you can see how it gets worse. And even other conditions, cancers don't go away if you just ignore them, and other chronic illnesses. So the point is always go get seen, and do it as quickly as you identify a situation. It'll save you money, and it'll improve the outcome for you, because the sooner you find something and get treatment, the more effective that treatment will be. But a high deductible health plan does not encourage that. It encourages people
Yeah.
to not go seek health care.
Yeah.
And so we see that. And then when they do go get health care, boy, they get it all. Once you've met that deductible, we see people that, they get everything done in 1 year. They're going to get a total knee and a total hip and a back replacement and, a couple of stents in their heart all in 1 year because, hey, I've hit that deductible. And so the total cost to the employer doesn't actually end up being less. It ends up being more because they maximize those things.
Mm-hmm.
So those is kind of a description of what's happened recently in kind of the commercial market and in a description of what's happening with how they're trying to influence personal behavior. They call it increasing consumer awareness in healthcare by having these high deductibles and giving information to employee beneficiaries and being able to search out and make better decisions. And in concept, I agree that people need to be more informed and make better decisions on their health care. But at the same time, there's still a lot there that is left unknown. And the decisions that end up being made don't empirically, when we look back, actually rendered lower cost healthcare and better healthcare. Yeah. So anyway, so we talked about Medicare, and then we talked about some commercial insurance for like a large employer that might be out there. The next category, go ahead.
So you would say that for the individual, they're going in, you would recommend at least some form of healthcare would be the first step, is what I kind of summarize this to be.
Yeah, they need to get, don't delay. Don't go be seen by a provider in their office as quickly as possible. If you can't get into a doctor's office, because that can take 3 or 4 days sometimes to set up an appointment, you can get online and you can request a visit online with a provider. There's a growing number of services that are there, and they can give you at least an idea how urgent is this, and prevent maybe an emergency visit, but they can take care of some things on the phone and give you scripts. But don't delay getting health care. I always seek care. But
yeah, that subject is interesting. The telemedicine. I recently, I haven't gotten sick in years, but the last time that I did was probably about 2 years ago. I just a cold. I needed something, and I called. I did the telemedicine thing. They called. They told them my symptoms. I think we did a video chat. That sort of thing. And then they called and they sent my information over to the local pharmacy, and I got seen. So the telemedicine is a very effective way for the individual to avoid, one, having to go in when you're sick, because that always sucks, and then two, it also saved me a lot of money. I only paid $60 for that visit, and then I think it was like $10-$20 for the medicine, where it might have been different had I gone into an actual office. So that is one way. I just wanted to reinforce that. And telemedicine is a great innovation that we're seeing come across.
Yeah, and it speaks to just the dynamics of normal business, where if there's a need, there will certainly be a group of people who try to find a solution to that need. And so I like that service. And like I said, my proposition is be seen as quickly as possible. Speak to somebody on the telephone or telemedicine. And it does point out an interesting reality that when you go to a doctor's office, they're going to order a bunch of tests. And if you go to telemedicine, they're going to do a traditional, they're going to look at you, they're going to do a real exam like they're trained to do in medical school. They're not going to order as many tests because there's a different motivation there. When you're a physician or provider and you work for a system, you're encouraged and almost required to order a bunch of these tests so that they can have the downstream profit from them. When you go telemedicine, you're paying them directly. They're there to work for you, versus in an insurance basis, they're caring for you, but they're working for the insurance company. It changes the relationship, and it changes how they practice. But it's not to say that
the insurance company, or are they working for like the hospital that they're a part of, like the hospital system?
It depends on if they're paid by the hospital, then they're working for the hospital. If they're billing insurance directly for you, if they're an independent provider, then they're working basically for the insurance company. They're trying to, their decisions are somewhat influenced by what the insurance company pays them or allows them to do, whole pre-authorization game, that kind of thing.
Yeah, yeah.
So,
That's such an interesting dynamic. I'd never thought about that before, where our insurance companies, or who exactly is the doctor working for as we go in to be seen by them. Um, you and I, in our consulting practice, we've talked about this idea that you can have downstream revenues. Um, I kind of want to jump into that a little bit so people understand why doctors do what they do. Um, so when they are going and ordering all these tests, what are they trying to do as far as the whole system goes?
well, excellent question. Just give me just a couple minutes, and let me answer this. So we talked about Medicare. We talked about commercial insurance. After that, you can have an exchange plan where you buy something on the internet, or you can, if you don't have access to insurance and your income is below 100 to 130% of the federal poverty level, you can qualify for Medicaid. So, but there are quite a few people who are self-insured, meaning that they don't have an insurance and they just pay out of pocket. And so just want to describe what those mechanisms are so I can answer your question. The question being, so when a hospital or a provider, they're eventually going to be paid by somebody, does that influence what they do? And my observation over time, being in the middle of those conversations with physicians and practitioners and hospitals and CEOs and all that kind of stuff, I would say yes. Money influences everything. And the federal government, the Medicare program, has a certain way in which they pay, and it has a big impact on the way large hospitals are run and medium-sized hospitals, small hospitals are run, the way physicians behave and act. And when they change reimbursements, it changes behaviors. It's very clear. You see it every year because that's the reward coming back to those providers. Some of that is good, and some of that is not so good, and can be even unethical. When a provider is working for an insurance company, insurance companies have all kinds of databases, and they require doctors to do certain things. They have to document a certain way. They have to call and ask for pre-authorization on certain things. They pay more for certain codes and less for certain codes. And so the doctors, quickly learn what they need to do to maximize their reimbursements. And so what they need to do is a little different. Doctors in independent practice are searching for ways in which they can do more services in their office, maybe lab tests or other testing services, or maybe they have a surgery center and they take you to their surgery center versus someplace else. I'm not saying that's bad. I'm just trying to prove the point that you can look around and empirically see that how we reimburse healthcare, how you purchase healthcare, and how the provider is eventually going to be compensated has a big impact on the type of care you get.
Yeah.
Okay.
Yeah.
There is a general expectation is I bought health insurance, I should get the Cadillac. Doesn't matter. I chose the cheapest, the lowest premium, the worst insurance out there, but I still expect to be given red carpet.
Yeah.
And I would say no. That's an unrealistic expectation to have. If you buy the cheapest insurance, most likely there are only going to be a few providers in your community who take that. They're not going to be the best providers. The best providers limit their practices to insurances that truly compensate them for the time and expertise that they have. Healthcare is not an exact science. Not all healthcare providers practice the same as much as we would think that they should, but there are some that do a better job and some that do a worse. And so when it comes to your healthcare, you certainly want to pick a mechanism for which you're going to pay for healthcare that gives you access to good, honest providers and allows you to get all the care that you need to have.
Mm-hmm.
So, for example, I would say, for a senior citizen, I would never purchase what's called an Advantage Care plan. I would only purchase a traditional Medicare plan. Traditional Medicare, you can go anywhere in the country and get care. and you can purchase a secondary insurance, and you're going to be treated the best in that model. Odd to say that, but that's true. The minute you choose an Advantage Care plan and you say, well, I'm going with this insurance company, you're limited to that state and that geographical region and to the providers that are in that area. And they will then have a limited plan, and they'll have a lot of control over what gets pre-authorized, what doesn't get pre-authorized, medications that get used, things of that nature. So all of a sudden you've restricted where you can go and who's going to be helping you. And of course, the whole issue is how can I pay less? And if you pay less, you get less.
Yeah.
Very seldom do you pay less and get more. Can't think of too many of those. But so I just wanted to kind of answer that question and say, yeah, there's a big impact on the quality of healthcare that you receive based upon how you choose to pay for healthcare.
Very true. Very true. A lot of people might see that as maybe a failure of our healthcare system. And certainly the healthcare system isn't the best in a lot of ways, but the fact that you can choose where you want to go, and you get different quality depending on where you go, I think is an advantage of the way that we do the system. Do you think that would be better or worse under a single payer system?
Well, yeah, trying to speak a little more to that big subject and say, there's not enough providers. That's a big theme in all of our conversation. Mm-hmm. And true business, you never get past the economics of business, supply and demand. And so there's not enough providers. There's an increasing demand. We have all kinds of people who are working in healthcare. Some of them shouldn't be working in healthcare. But in order to be seen, we think, well, they're all the same. I can go anywhere. I can choose the lowest healthcare premium. I can go anywhere and get the best insurance or best care. That doesn't happen. I mean, you can't get it past basic business principles. And so I would come back to, ultimately we do have to increase the number of providers that are in our country so that people can get in and be seen, so that we can, through the principles of business, where, if you have a lot of providers and there are bad providers, people don't go to them because the word gets around, and you stop going to them, and they fall out of the business. But when you're in a situation where there's not enough, there are people who say, I'd rather get care than get no care. But it comes back to that question of a single payer system. I hear people all the time saying, well, the government's going to a single payer system, and this is going to be a bad thing. And they ask me, so you think the government's, is this one step closer to a single payer system? And I always have to laugh at that question. And this is the reason why. We have a lovely government. We have a lovely country. We have one of the best countries in the world. And it's based on the principle that e pluribus unum, of many comes one. But with that, we've got all kinds of people. And this is one solid truth that we know about our democracy. We can never agree on one thing. So do I think that we will all finally agree on one payer and one payer program? No. I don't think we can ever agree on it. So, I talked about in my previous episode how, one of the problems with healthcare is the federal government has so many programs, and they're competing against themselves, and they're inflaming the shortage of physicians because they've got so many programs. So do I see it likely? Not really. I mean, in the current model, based on age, we're supposed to all get to a single payer. We call it Medicare. But Medicare is pushing really hard. They're trying to get more and more insurance companies to take over these Advantage Care plans, get more people on Advantage Care plans. All of the empirical evidence has shown that Medicare actually pays more when people are on an Advantage Care plan. It doesn't lower the cost, but still somewhere there's an agenda. I don't know if it's due to politics to get more people to buy these Advantage Care plans.
The Advantage Care plan, what exactly is that? Because I haven't shopped the market that much. I don't know what the Advantage Care plan is.
So it's a substitute for traditional Medicare. So instead of, saying I'm going to pay my premium to Medicare, and Medicare is going to pay my providers, my hospitals for those services directly, that's what we call traditional Medicare. And you can go anywhere in the country and get care. You're not limited to a geographical region when you're on traditional Medicare. If you pick what's called a Medicare Advantage plan, then what you're picking is a company like Humana. Maybe different insurance companies are getting into that market, such as United Healthcare, Blue Cross Blue Shield, and you say, okay, well, I'll get my Medicare benefits through this insurance company that's in my state, it's in my region. Might be Kaiser, it might be a local kind of a healthcare system that's in my area that directly contracts. And so when you do that, you say, okay, I'm not going to participate in traditional Medicare. Medicare is going to pay a premium to my Medicare Advantage plan. I'm going to pay a premium to my Medicare Advantage plan so I can get some additional benefits versus going and buying a secondary insurance that covers my deductibles and copays. So, certainly there are a lot of salespeople. There's a lot of sales pitches out there, and they're all designed to say, oh, this is wonderful. This is great. Sign up today. And when in reality, the first thing it does is it restricts the providers you can go to. You can only go to the providers in that state or in that healthcare system. They then now are going to employ a pre-authorization process. So if you need any surgeries or anything that needs to be done, you have to wait for your provider to be able to process that. And everything gets checked. Every single lab, every single X-ray has to go through some kind of a database to say, yeah, that's medically necessary. Not as such the situation with traditional Medicare. And from there, hopefully that health insurance company that's selling you this Advantage Care plans can charge you a little extra for some add-on services that you get and make money off of that process. But inherently, there's now a third party in the middle of this process where it was you, Medicare, and your provider. Now it's you, Medicare, this insurance company, and your provider. So obviously it's become more complicated. There are additional hands, and that's why it will always cost more than just dealing with care directly with Medicare.
Yeah, that makes a lot of sense. So you're just adding more people. It's more, and you said it's actually more expensive for Medicare to do these Advantage plans, but they seem to be pushing it.
Yeah, over all the years that I've watched these Advantage Care plans, you come into the market and grow. Even just last year, I saw some articles all the way through the Obama era. They're like, yeah, we know that it costs more, but we just think that if we continue to push these, at some point we'll get a return on investment and this cost will go down. And they've not. The economics there. You can't put a fourth entity in the middle of this relationship and expect for it to be less unless you're cutting something. Yeah. Either the beneficiary is going to get less, the provider is going to get less. Somebody's going to get less to pay for that fourth person.
Yeah. And obviously the beneficiary is already losing out because they could pay less for a regular Medicare plan and be seen all across the country. Yeah. Especially for seniors, like you said, if they're pushing that on seniors, it sounds even more horrible because they might be visiting their children in a different state, and now they can't receive health care. So yeah, it's kind of crazy that they're still trying to push that.
Yeah. So that's a good description of what's happening with the Medicare program. It's very political, albeit most people who are in the federal government are at Medicare age or near Medicare age. There is a lot of preference for those things. There's a lot of favoritism, but you can't get around the fact that the baby boomers, the single biggest influence on the cost of healthcare right now, is in the Medicare age. They're consuming more healthcare and will only continue to consume more and more healthcare as they get into their 70s and their 80s, and eventually into nursing homes and things of that nature. So very expensive. But we talked about in previous episodes, the single biggest issue is not all the payers cover the cost of healthcare. Medicare doesn't cover the cost of, they say Medicaid doesn't cover the cost of healthcare. They pay less than the cost. Well, where does a provider make up for that? Well, they make up for it by charging commercial insurance more. And Medicare only pays for the cost of healthcare, so they're not paying for people to get a profit. So where does a company come up with monies for profit? So they have to do that with commercial. And so this has been happening for many, many years. And commercial insurance, the prices continue to go up, the insurance premiums and reimbursements and things of that nature. And so that's the area where we're seeing just substantial change. A lot of providers getting out of providing the benefits, going to alternative models, high deductibles, just all kinds of mechanisms to try and avoid the ever increasing cost of healthcare, and leading to a situation where people don't have appropriate access, and also being in a situation in which they're trapped with an employer. You work for an employer, you have a healthcare condition, you want to go someplace else. It's easier now than it was 10 years ago. HIPAA, Health Insurance Portability and Accountability Act, made it a little easier for you to move employers and then get new benefits. But the issue is now is there's just not as many employers providing benefits. And there can be at least a couple months of waiting time. You get into a situation where you're, COVID, all of a sudden the company laid off 10, 20% of their employees.
What do people like that do, where they get laid off? They had both health benefits before, but they get sick while they're still trying to find new work, or they got a new job that doesn't provide health care. How do they navigate that system where, it's extremely expensive to pay for your own health insurance?
Yeah. So the first thing that has been provided, a program by the federal government, something called COBRA, where they require your employer to continue to provide you with health insurance after you are laid off or leave maybe you're terminated, whatever it is. If you've worked with the company for so long, then they're required to offer you COBRA benefits, but you have to pay the full premium. You get access to it, but instead of you paying, say $200 or $300 like you used to on the plan, now you have to pay the full cost, which can be $2,500, $3,500 a month. You're like, I just lost I have no income, and you want me to pay 30? I can't. My mortgage isn't that high, so it can be expensive. Now, during this time of COVID, there is a special program in which people don't have to pay for their COBRA benefits. They can request that of their employer that has laid them off, and then the employer can then you get reimbursed from the federal government for those premiums. So they process it through their quarterly payroll taxes that they would pay on behalf of their employees. So there is a mechanism, but it's it'd be short-lived. It's not a permanent solution. But what do most people do? They just simply can't afford it. Only if they're like in a cancer situation, they're in a real bad situation, will they go out and come out with a home equity line of credit and come up with the money to pay that premium, because it's better than paying the cost of healthcare. So a few people do that, but it's not common. What do some people do? They go without. There is since Obamacare, there has been an advent of an alternative insurance model, and it's a cost sharing program. Mm-hmm. So basically, it works kind of based on the religious kind of exemption that organizations with certain common religious beliefs, expectations, practices can work together and share the cost of healthcare amongst those who participate. So there's a variety of programs out there. You usually see the word share in their name. Liberty Health Share is an example of a plan. And so you can find these on the internet. You speak with the individuals. You find that common interest that you agree to abide by their certain practices. Now, they're not pushing doctrine. So most of those organizations will allow a variety of individuals with various religious beliefs, such as Muslim, Christianity, Catholicism, various groups and within the evangelical movement, things of that nature. You don't have to be in the same group. You don't even have to necessarily be within the same exact doctrine. Basically, it comes down to you agree to, maybe not smoke, not drink, live a healthy life. So it has more to deal with your healthcare practices. So it's pretty simple. It's kind of like working with a credit union. You can become a member of a credit union because you are affiliated with an employer, and they work for your benefits like a non-for-profit. So that's That's what these health share groups do. And so everybody pays in a premium, and then claims get submitted to the central office. They pay those claims based upon a certain Medicare reimbursement level, and maybe they have contracts with the providers. But most of them don't. They just pay what they're going to pay, and in most cases, it's better what the insurance pays, and so those providers will write off the balance. Very seldom do I see when those providers get upset and won't write off the difference between what the employer paid or the health share program paid and what was the allowed amount. So there will be some copays and some deductibles, things of that nature. But I find that the copays and deductibles are lower than what you would find in commercial insurance. They pay the provider better, and the premium is much lower. I can see premiums in the ranges of $500-700 to insure a family versus $2,500 to insure somebody through commercial insurance. The other added advantage is you can go anywhere in the country. If you're traveling, if you got kids in college here and there, wherever it may be, they're all covered. But when you buy a commercial insurance, you leave your state, you're not covered except for emergency services. So it costs less, better benefit, doesn't require as much pre-authorization, those kinds of things. All around a better experience. Encourage a lot of people to look into that. I moved to that when I became a small employer and was dealing with, do I buy insurance from Blue Cross Blue Shield, United Healthcare? Do I pay $3,500 a month in a premium to insure my family to get a $10,000 deductible? So I'm out $50,000 before the insurance company actually pays. Or do I put some of that in savings and buy one of these health share plans, participate in one of these health share plans, and get my health care in a much better environment, much better cost and much better environment. And that's what I've opted to do. And that's what I would recommend most folks do, because it doesn't matter what I'm doing. If say this year I'm in my small business, next year I go to work for an employer, I'm not going to drop this plan. I'm not going to go on to another employer's plan anymore, because I just gave over my health care to them, and I'm out of control. If I lose my job, all those kinds of things, it's much cheaper for me to remain. I want my insurance to go on. I want to deal with the same people, because my healthcare condition doesn't change when I go from employer to employer.
Sure.
So I want consistency in knowing where I can go and how I'm going to be treated and how that's going to be taken care of. And so I do anticipate seeing over the next several years, most employers will get out of health insurance if they can. Certainly the federal government will try to prevent that, but still, you can't change the economics. Those companies will outsource their jobs to foreign countries where they don't have to provide health insurance. And more employers will say, well, why don't I participate in a self-funded plan, or why don't I participate in health share? I'll pay for your health share premium versus buying health insurance for you. Or how about I pay for your tuition, or I pay for your retirement, you go get your own tuition or your own health care. This mechanism where we say, okay, not everybody is paying for the cost of health care. Mm-hmm. A lot of people everybody's trying to get away with paying less than what it truly costs to provide care to them. And there's a lot of people getting away with it. And so they move it to those who can't get away with it, which is usually commercial insurance. People, 45 to 65 years old, work in a nice, really good company, starting to experience heart issues, orthopedic issues, things of that nature. They're not only going to pay for their health care, they're going to pay for the Medicaid person. They're going to pay for the person who came in and didn't have insurance. They're going to pay for the fact that Medicare doesn't provide a profit. The providers in the hospitals are going to supercharge them in order to come up with that profit.
Yeah. Very difficult to get around.
Yeah. So you create that kind of burden on one entity, that entity will eventually go away.
Definitely.
So that kind of gave you, I don't know if that was two birds for one stone. You were asking, do I think I'll go to a single payer system? No, I really don't. Certainly, in our country, the government likes to create mandate certain levels of service and certain programs, but then provide choice to people. So, like for example, we see in the exchanges, they say, okay, this is what an exchange plan has to be, but then they'll let multiple companies come in and offer that exchange plan. Or we got Advantage Care plans, we've got Advantage Care plans for Medicaid beneficiaries. So, once again, there's multiple programs. The more programs we get, the more cost comes into the system.
Yeah.
So we're going in the wrong direction. But I don't see a single payer system, because we can't all agree on that. But number two, I just, what is the future of insurance? Can we rely upon it from corporate America? I know. I would not trust it. Corporate America is quick to lay off, to terminate employment, to do whatever with people who cost them a lot of money. If you have high healthcare costs, if you demand certain benefits, things like that, they're going to find an alternative to that. And maybe that's outsourcing. Maybe that's doing different things. So I see ever increasing economic pressures to get away from it. It'll be somewhat subsided by federal government saying, no, you can't, you have to have it. Employers have to provide it. But, once again, there'll be exemptions here and there for certain special groups, large, small employers. And
I feel like that would you would even start to see benefit or like problems of like if someone doesn't present in an interview as being the most healthy person, that could be another reason that they don't get hired.
Very true. I mean, I know we say that there are laws that deal with age discrimination, and there are laws that prohibit employers from asking questions about your health care and things of that nature. It's pretty easy to have an interview and see how old somebody is. It's, we wouldn't pass these laws if there weren't companies trying, that have and continue to terminate people. I mean, supposedly you're supposed to be a protected class of people if you're over the age of 45. I see people over the age of 45 being downsized all the time. They come up with a different reason. There's always a reason to justify and explain. Oh,
This branch of the company is, we're closing it down.
Yeah,
everyone else is getting moved out, but not you.
Yeah, his skill sets become obsolete, and that person, they just don't get along with anybody, and so it happens. Now, why do companies purchase health insurance to begin with? Well, it used to be the reason why is you didn't want people remaining employed with you beyond the age of retirement. You get to the age of retirement, you want people to retire because keeping them employed is going to cost you a lot in health insurance premiums. That doesn't get talked about much, in the executive circles, but that's the real reason. So which is more important? I actually think it's more important that companies provide a good retirement program so that people can afford to retire.
Yeah.
And you can, have those people when they're 60, 65, retire and let them go on and enjoy life, and then rehire somebody that's 24, 26, 30 years old, and with the most current training and things of that nature, and that just move things along. But that's a whole different concept. They revised retirement benefits 30, 40 years ago when the baby boomers began entering the market, so they'd have a full career life cycle to make it. But you don't see those benefits anymore. Defined benefit plans, all 401k. We're seeing a lot of people in the baby boomer era and even subsequent generations struggling to be able to retire. In fact, the Social Security Administration, IRS, not IRS, excuse me, our own retirement program for elderly people. You used to be you could retire at 65. You now can't retire until 67. So we're moving that up. Yeah, we say, well, people are living longer, but employers need to be able to move that cost off of their books, and they'll find a way. That was the point. But I think we were trying to figure out how do we, as individuals, what can we do? What can we do to decrease the cost and get a better experience with healthcare in light of all of these changes? Mm-hmm. And number one, I would say certainly it's important to be educated. These episodes talking about what's truly causing the cost of healthcare to go up, and having that accurate information influence your involvement with political groups, our government, and your employers, and making decisions and requesting certain things, and working with your providers and your hospitals and things of that nature. You need to be educated so that you make better decisions and not just rely on the physician. We give too much reliance on the physician. You've heard me say that. He's in the middle, and we just go in blind as sheep and just whatever, and I'll pay for whatever. We need to be involved, but be involved in the right way. Certainly you heard me say, not going to healthcare, that's not being involved. You got a healthcare condition, go in and be seen, but know what's going on. Yeah. Number two is you got to have a plan for how you're going to pay for your healthcare. If you're a person who chooses to have a high deductible health plan, you need to set aside that money, that $150 or $100 or $50 a month you're saving in the premium. You got to put that in a savings account so you can pay for that increased deductible. Quickly going to find out that it doesn't really cover the cost. That savings doesn't cover the cost of that higher deductible, and that the plan that you have really isn't to your benefit. It's better off having an insurance that covers your doctor's visits with copays, first dollar, versus after that $5,000 is met, because you need to get seen immediately for something. Number two is your own, take care of your health, yourself. Know what's going on with your body from a genetic perspective. Get tested. Go to those health fairs. Go see your doctor for your annual evaluations. Know what's going on with your body over the course of time. Have better healthcare choices with regards to use of tobacco, illicit drugs, alcohol, various things of that nature. As indicated, 95% of all healthcare costs are due to personal choices. Only 5% of healthcare costs are due to genetic issues. And there are clear studies about what is the cost of health. Where do we spend our money in healthcare in developed countries versus where do we spend our money in developing countries where people don't smoke as much, they don't use alcohol as much, because they just don't have those kind of incomes to be able to indulge in those kinds of things. And it's a big difference. Most of what we do is self-inflicted. Yeah. From there, I'd say, find a better way to pay for your insurance. Look at these health savings account, or not health savings, the health share programs that are out there. And there's a growing number of providers that are just saying, if you can't afford a full-fledged insurance, maybe you can afford to pay your clinic $70, $80, $90 a month, and they'll provide whatever care you need in that clinic. It wouldn't cover you, someplace else when you travel or that, but for the most part, we do stay close to home and we access care in that area. It's better than nothing. That's really the model of the Kaiser Permanente. You buy insurance from them. They are both the insurer as well as the healthcare provider, and it just creates an overall better dynamic when we do that. There's some other examples. Intermount Healthcare in Utah has a similar model, and we see some that develop in other areas where they say, what, we understand this concept. We sold you the insurance, and so when you get a healthcare condition, we want to know as soon as possible. And they make available telemedicine. They make available to you get into a doctor's practice. They make available to get into the hospital, emergency department, surgery, same-day surgery, whatever's the lowest, most appropriate level. They want to get you in. They want to get you fixed. They want to get you back to life because they know that saves them money, because they've combined that whole program. Versus, the more traditional model where you have an employer, and then you have an insurance plan, and then you have the provider, and then you have the beneficiary, and they're all kind of playing their own game, and they have their own self-interest. And most of it is, let's just take as long as we can before we provide care. So know those kinds of things. But any other questions? Have I covered, some good topics for you? Is there something I'm not thinking of?
I think one last thing before we wrap it up would be self-pay programs. What would you advise about self-pay programs? A lot of the healthcare providers that I've seen offer some form of it. Is it advisable, or would you say that it is better to, get an insurance program or do you just take all that money that you would be paying into an insurance program and put it in a savings account and then use that?
Well, the issue with healthcare is that you never know when you're going to have a big event. It could be a motor vehicle accident, a skiing accident, something of that nature. It could be discovery of cancer. So you're insuring events, very big thing. So my advice is research and pick a better long-term plan. Sometimes based on incomes, that's just not possible. It's just not possible. There is a segment of our society that is in a crack that, between, they have the training and experience to get a good job, get good insurance, get paid well for what they do, versus a lot of folks that are in construction, they're in restaurants, they're in retail, not paid well, don't have access to health insurance, don't qualify for exchange plans, don't qualify for Medicaid, and they're just out there on their own. And if you find yourself in a situation in which you are without an insurance program to cover you and you needed care, number one, don't delay going getting care. You'll hear that from me time and time again. Go see your doctor's office. Get online, first of all. Can't care for it online, then go to a doctor's office. Don't wait for it to get really bad and then go to the emergency department. That's going to be the worst thing for you.
And by online, we don't. The recommendation there is not to go to drmed.com or something, but go to an actual telemedicine doctor and be seen by them.
Yeah, there's a lot of reputable programs, and they're rated, and you're dealing with a licensed provider, and they're going to perform an exam for you over video. But so if that wasn't available to you, go into the emergency, go into the doctor's office. When you're done and you get that bill, or even before you get the bill, as you're getting care, ask that company, what programs do you have for self-pay? Every single hospital is required to provide some kind of a program for individuals without insurance. And if you pay promptly, you will usually get the best discount. If you can't pay the full amount promptly, then you can set up on scheduled payments. And if you honor that, they will write off certain balances. They'll give you discounts to try and get you down to Medicaid rates or Medicare rates, things of that nature, because a lot of healthcare is still tax exempt. A lot of the providers, a lot of the big hospitals are tax exempt organizations. Emergency services are required to provide stuff under EMTALA regulations. And so everybody has a program, and they're required to let you know about it. But usually we don't pay attention until there's a need. And so ask, don't be afraid. If you wait, the opportunities for those programs become less and less. So go in, speak with the business office, and say, what's available? What do you need? Usually they'll have you fill out an application, and based upon number of people in your household and your income, you'll be eligible for certain discounts and maybe even free health care. It won't cover everything. It only, those discounts will only apply to the services provided by a system. Let's say, for example, they contract with radiologists or pathologists outside the system. You'll have to work with them separately, because we all know when you go to healthcare, you're going to get bills from 5 different directions. But the main bill, that hospital system usually has a program. They can deal with you, and those doctors' offices, they're used to getting 50 cents on the dollar. That's what Medicare, Medicaid, commercial insurance pays them. So you call them up and you say, hey, if I pay this in full right now with a credit card, will you give me a 25, 35% discount? They'll say, yeah. They want to be paid. They want the money today versus, payments over time. So, yeah. Very good question.
Definitely. So you would recommend, it is always more wise to have a healthcare payment system of some sort, whether that be a health share or health insurance or Medicare, Medicaid, whatever that is. It's definitely wise to have that, because life happens and you don't know. But if you get caught out without insurance, then there is a method to self-pay.
Correct.
Okay, awesome. Do you have any other questions for me, or anything that you want to go over before we conclude?
I just think these are excellent. We get into subjects, and it's easy to go off on, you go deep into that subject, and there's just so much to talk about. It just, we were just talking about the simple subject today about how does rising cost of healthcare affect the individual and what can they do about it? And we look forward to talking about what can employers do about that, and then how can providers and healthcare systems be able to remain successful and fulfill their mission in light of these changing programs and the need, changing or reducing healthcare costs. Reducing healthcare reimbursements to them. So we want to propose solutions to everyone that are mutually beneficial to all participants in the healthcare system. So look forward to that.
Definitely. Awesome. Well, thank you. I think we'll
Thank you.
wrap it up there.